Hello, friends, and welcome to The Unconventional Alchemist. I'm your host and resident storyteller, Tracy Scott, and it's been a minute since we've been together for a podcast. It's a new year, and I'm emerging from that holiday envelope, maybe you could call it, and I'm ready to go. So I know some of you are more into the winter hibernation feelings right now, but not this kid. I received some really great insight from a friend before the holidays about going back to my roots as a respiratory therapist. And the number one question I have had for as long as I can remember is, what is respiratory therapy? So I've been thinking about it for quite some time since I had this chat with my friend. And it even came up over the holidays when I was with some friends and talking to their daughter about possible careers that she could look at. So I thought I would share some insight into how I discovered it, kind of my path through it, and how it's landed me where I am here today. So way back in the day, this would have been in 1989, it's a long time ago, I was pre-med doing my undergraduate degree in biology. So I was it wasn't 1989. That's when I started my degree. So by my third year, I was working really hard towards this goal, not overly loving the environment of academia, if I'm completely honest. I am not much of a rule follower. And I started getting sick with recurrent ear and throat infections, repeated cycles of antibiotics, and I was really struggling to maintain the workload of both school and job. The science degree is a little heavy on the hours for school, and then I was working a part-time job at the same time. In my second semester, so again, my third year, second semester, I was reading one of my biology textbooks and discovered that my sickness was probably likely coming from my tonsils. So I traveled home to see my family doctor. He agreed, and it was so quick, I had surgery to remove them the following week. So again, this is the early 1990s. It might be quite different now about how they would proceed to treat this problem, because honestly, it was a pretty terrible experience as a young adult. I was 21, and it was not an easy experience for me. So because of all of this, I did decide to kind of drop the pre-med experience. It was just too difficult. I reduced my course load and then took some classes that I actually really wanted to take versus those that I had to take to complete that particular degree. And it was my physics TA, teaching assistant, that dropped this respiratory therapy nugget into my lap. So he told me about a school that he was planning to go to the next year, so after he finished his undergraduate degree. And it was a school called the Michener Institute for Applied Health Sciences in Toronto. And he was going to be taking a program called nuclear medicine. Then I discovered that another friend of mine was also going the next year, and he was taking something to become an X-ray technician, or I'm not sure if that's actually the appropriate word or not. So I started investigating this school and all the programs they had, particularly respiratory therapy, because my TA was right that was the one that would probably attract me the most. I was hooked. I didn't apply anywhere else, and there are several other schools I could have applied to in Canada. I did an on-site tour at a local hospital to me. And then you had to do that and just kind of get a flavor for what the profession entails. And then I did a panel interview at the school, and then I gratefully accepted my spot for the following year. So here's a little bit about where respiratory therapists work. So I'm going to speak mostly to the hospital environment at this point. So we work in a variety of environments. So we're not just in one department within the hospital, we're kind of everywhere. So everything from critical care units, emergency departments, operating rooms, diagnostic testing laboratories, rehabilitation programs, asthma clinics, and then you can go on into some other things, home care companies, pharmaceutical and medical equipment sales. So it's quite vast where we find ourselves. You can also go on and become certified and get some advanced skills in things like the NICU, those lovely people that run bypass machines during certain types of surgeries. There's all kinds of different things that you can do. One of the things I absolutely loved too is that we're able to provide care to adults, children, and newborns. So it was a wide variety. We got to work with everyone. So some of the things that we studied in school are cardiopulmonary diagnostics. So that's your cardiovascular system plus your respiratory system, since they're so connected. So we learn how to diagnose various things that are going on there. We look at rehabilitation of those things. We learn about pulmonary ventilation, so how to work with ventilators to keep people alive, things like that. We look at pharmacological therapy, so that's medications. And again, it's all about the adult, pediatric, and neonatal or newborn kind of critical care. Some of the skills that we learn over time are using medications, therapies, various assessments to assist in the prevention, diagnosis, and treatment of heart and lung disease, how to use mechanical ventilators, like I already said, and then just other life support equipment to sustain life. So when I went to school, and this is still pretty similar now, we did 2 years of didactic or classroom work. And then we spent 1 year doing clinical work where we were closely under the supervision of respiratory therapists that were already working, doing their thing, learning how to kind of integrate all of that knowledge and skills into practice. It's a very hands-on experience in a work environment, because it's one thing to learn all these things theoretically and then apply them to an actual individual. It's a big jump in that sense. So after you've done all of this and you're still tracking well, there is an examination to become a licensed respiratory therapist in Canada. And that was, I don't know if that exam is still the same. It was like a full day exam, multiple hours. It was you tested on everything that we had learned in school. And then there are various provincial government bodies that regulate the practice, and they are there to govern members in the public interest. So they make sure that there are entry to practice requirements and then standards of practice to facilitate continuing competence. So they're there to make sure that we are, all at a minimum certain level and that we are treating our patients well. And we are part of the Regulated Health Professions Act, which includes 26 regulated health professions in Ontario. I'm not completely sure about all the provinces across the country. And I'll tell you, I loved the entire experience of school and thrived in my clinical placements. It was quite different from, like I was talking before about my undergraduate degree. This was just a very different experience from the academia world. So these experiences, they were often intense because at the end of the day, we die when we don't breathe for even just a small amount of time. It was heartbreaking, it was exhilarating, and everything in between. I feel very fortunate I was able to work at a downtown Toronto teaching hospital where the RTs, I will often use that short form, so RTs being respiratory therapists, we had a very active role in how patients were treated. So as for example, some hospitals, you will, for example, ventilate a patient based on a doctor's prescription. So they might prescribe the percentage of oxygen, the respiratory rate, the breathing volumes, all these different things. And then in other places, they may instead, so you're still working under a doctor, but they might give us prescriptions to ventilate someone to specific parameters. So they might say, we want to keep the amount of oxygen in the blood between this range, or maybe a better example is, maintain blood oxygen levels at 95%. So then it's open. We can do all the different things that we think are appropriate to try to maintain that level. So it gives us a lot of freedom. So like most things in my life, my journey through the respiratory world isn't really typical of most. Most do go into the hospital environment, working in those more critical care settings. When I graduated, there weren't a lot of jobs in the hospitals at the time, so I went into the home care realm. So there, we were focused much more on, again, the cardiopulmonary diagnostics. So I spent quite a lot of time actually doing the diagnostic work. So working with a physician, he would send his people to me and I would do all the testing and then send those results back to him, and we would come up with a plan for those people. Spent a lot of time working with home oxygen therapy, ventilation, tracheostomy care, asthma, suction, again, with adults, kids, newborns, everything. I was able to also spend a lot of time specifically working with sleep disordered breathing treatment. And eventually down the road, I got into some diagnostic work. I was able to move on into some national roles. So I went from working in a home care branch in Toronto, took on a national role because the company I worked for had branches, 80 some odd across Canada. So I spent some time working in safety and quality. I worked in product management. And then I went on and did my master's in business administration because I was seeing that I needed to make some changes because of some things I wanted to do. And then I moved on into sales and marketing, got into sleep diagnostics, and eventually took a trip through Australia. And I took a trip, I went to work there for 5 years, because the company I was working for was an international company. And I was able to do my thing over there for some time as well. So in all of that, because that covers decades of schooling and work, I also had my own journey with obesity and health that's woven through all of that. And I'm not going to get into all of that here, but I did have gastric bypass surgery in 2011. And then from there, obviously life changed. That was a pretty life-changing surgery. So I had that. I moved to Australia, hired a personal trainer, started to discover this whole new way of eating and living, getting healthier in some ways and worse in others, like it often works, right? So life was moving along. I got really sick again in 2015, and lots of things changed. So at the time, I was severely anemic. I was pretty stressed out from a more than full-time corporate job and an abusive relationship at home and some stepchildren. So it was a lot going on. So I found myself back in the hospital for a variety of different things, ended up being relieved of my employment as a result. So I was made redundant and, walked away from the corporate job I had had for a very long time. So I was really starting to search for ways to kind of find my feet again. So I put all my efforts into the private transportation business that I was already cooperating with my partner at the time, and only needed one more trip into the hospital to find my feet enough to eventually leave that relationship, because that was the last piece that needed to happen. So I did move back to Canada and started doing some much needed healing. It was kind of funny too. My old boss offered me work as soon as she found out I was back in the country, but I knew I wasn't prepared to return to that kind of corporate/city life at this point in my life. At the same time, it's not easy to find work in a small city. At 45 years old, a trained healthcare professional with all this international sales and marketing experience, the story. I do prefer working for myself. So I decided I should maybe lean into something that I felt called to me at this point in my life, and went along with all the experiences I've collected along the way. So, it's been a long career, and it was like, what's going to be the next step for me? And it was funny because it was personal training that stepped forward. And funny little side story. I had thought about this before when I was still in Australia, but my ex had convinced me that I would be just a terrible trainer. So I left that to leave me at that point. But that was just silly. So I loved working as a personal trainer. It really does complement my background in biology and respiratory therapy, and I could be my own boss. So I signed up for a course to become a personal trainer. At the same time, so while I was doing all of that, I did stumble across a job posting for a kickboxing instructor. And remembered how much I loved doing that with my trainer back when I first started. So I pursued that as well and started working at a private kickboxing studio. And that was probably one of my favorite things I've ever done. So in there too, so I'm doing some online personal in person and online personal training with people, working at the kickboxing studio. I quickly realized that I needed to pick up some kind of training in nutrition coaching, because I knew how to do some things for myself, but I wasn't super capable of helping my clients. So I took that on, and then eventually moved to a new city, moved the kickboxing experience there, and eventually took that into a different private gym. So I ended up moving away from all of the online and at-home personal training and nutrition coaching, moved everything into the gym, and again, loved it. I was teaching all kinds of different classes and personal training and all kinds of different things, and it was a blast. Then we come to COVID restrictions. So that really changed the environment in which I was working. And I started to use my extra time to start creating some online courses around sleep and breathing and nutrition to supplement all of my personal training resources, because I was realizing over time is that as much as it's fabulous to come and spend your time with your personal trainer, but all these other things are important as well. And you just don't have enough time, and you're not there for those things within your personal training session to talk about all these things. So I started, like I said, building some resources that I could share with people outside of there. I did eventually move back to working for myself and continue to play in this space, which I love because it allows me a lot of freedom to change things up and pivot when I need to, and just be able to offer different things to different people. And then I always continue educating myself, because that's just the way I like to work. And I've spent a lot of time and resources educating myself around mobility training, lymphatic massage. And I also, in my spare time, created a new business that's centered around botanical medicines. So here we are today. If we look around, I see this a lot. You see both sides, but many people are probably the sickest they've ever been. They're struggling with anxiety, depression, and chronic pain. And again, if these aren't you, that is fabulous. I'm so happy for you. But I do know a lot of people are struggling with these things. And I'd rather talk about them and offer some solutions and things like that from my own experiences versus ignoring them. So because I see all these things, but I am incredibly optimistic about our future. And I know we have what it takes to change this direction. And it only needs one person to create massive change in their circle of influence. And what I mean by that is, if we're working together and you're making changes in your life, and they don't even have to be big, they can be really, really small to start, but they ripple out and they start to impact those that are close to you. And it really reminds me of the whole act of breathing. So, I try to losing how I want to bring this out, because I want to talk a little bit about quantum physics. So, working with someone, and you're paying attention to them, right? Like, it changes a person. And that's where I was going with the quantum physics. So in that, the idea of observing a particle changes the behavior of the particle. It's a really strange thing. And your breathing is like that too. So you breathe all the time, because without it, we wouldn't be here. And we don't even have to put any thought into it at all. But as soon as you start to pay attention to it, it changes. So let's do a little bit of an exercise. So just take a moment if you can. Like if you're driving your car, don't. But if you're sitting or standing and you're not got a whole lot going on, just take a moment to notice your breathing right now. Did you find that you automatically sat up or stood up a little taller? Did you take a bigger breath in? Or are you doing that now? I'm just going to throw some questions out at you. So just again, paying attention, not trying to force anything or breathe at a certain rate or any of those things, just seeing what your body's doing. Did you find your shoulders up around your ears? I find that one often. Are you breathing through your mouth or your nose? Can you hear yourself breathing? Are you breathing into your chest or your belly or both? Is it fast, slow, or is it maybe even irregular, where you might notice that you're holding your breath? So as much as we have a tendency to do or to overdo many things in our lives, most of us are also overbreathers. So let's talk a little bit about functional breathing. So there's lots of studies out there and they vary, but they estimate that about 60 to 80% of us have dysfunctional breathing patterns. That's a lot. 60 to 80% of us have dysfunctional breathing patterns. Some of the things that this can look like are mouth breathing, big breathing, so taking in really big volumes of air, fast breathing into your upper chest, breathing that is audible at rest, sleep disordered breathing, and then irregular breathing with frequent involuntary things like breath holding, yawning, or sighing. So those are some of the big ways that this will show up. So just, think about your own assessment of what you found when you were paying attention to your breathing and maybe those around you and see if you see anything. So functional breathing exercises aim to eliminate mouth breathing because we are not meant to be breathing through our mouth. We should be breathing through our nose for lots of different reasons. We also want to normalize that breathing volume because we do tend to breathe too much in terms of volume. And doing some of these things will just help to restore the balance of the oxygen and carbon dioxide in our blood. And then the other thing we really want to do with functional breathing exercises is build the strength of our diaphragm. And all of these things are going to help reduce breathlessness or shortness of breath, depending on how you want to say that, and any symptoms of things like asthma, anxiety, and stress. The other beautiful part of this is that it enhances your sleep, which then just leads to better all-around health. So in our modern world, we tend to focus on optimizing our diet and our exercise to improve our health and well-being. And those are fabulous things to do. And we rarely pay attention to our breathing. Yet it is arguably the most accessible tool for all of us. We all have what it takes to improve our breathing patterns. And they can have profound positive effects on things like boosting your sports performance, improving your health for the long term, enhancing focus, concentration, posture, and sleep, reducing anxiety and that shortness of breath. For those of you that get exercise-induced asthma with things like running, it can help with that as well too. So breathing is meant to be this very dynamic thing that we're doing, and it's meant to, be very efficient in a variety of different functions, taking into account the different circumstances and conditions. So what I mean by that is that it should be appropriate for activity and rest. because you have very different demands on your body for those things. And some of the functions that are happening at that time are gas exchange. So you're moving the oxygen in, getting the carbon dioxide out. We're moving air. Breathing also helps us with our sound production. It helps us with our sense of smell and protection. And this is what I was talking about before, when we're meant to breathe through our nose versus our mouth, because we get a lot of protection for our body by doing that. So there's kind of 3 pillars involved in functional breathing, and that is biomechanics, so how the system moves and works, biochemistry, talking about, again, those balances of the gases in your blood, and then psychophysiology, because it does have an impact on us as well too. And we can really, it's not even hard to do this, but we can train our body and our mind to become more of a functional breather. So that's what I'm doing. I have created a space and community where we can all become more functional breathers. This is a space I've had for quite some time now, and it's just morphing as time moves on and we realize kind of what we need in this world. And in this space, we operate at a slower pace than what you might be used to. And we're really focused on the long game. We can get short-term results and move the needle pretty quickly on some things, but we always keep the long game in mind, because life is a long-term thing, hopefully. I don't act as a gatekeeper of any kind of information. I like to share what I know. The more two-way communication that goes on, the better we all become. And if I don't know something, I'm happy to go do some research and see what we can find out. And it's a space where you can ask questions. It's been described in the past like having kind of a therapist in your back pocket. And my goal is always to provide very clear, concise, and simple insights to work with your breathing and improve your all-around health. It's a monthly subscription, so you get to manage that. You can, be in for as long as you want or cancel as quick as you want to. It's all good. Like I said before, we change things up as required so things don't become stale or repetitive. You would just have to ask some of the people that have been doing this with me for quite some time and how much it has changed over the years. And I really try to make it a place that just makes people feel comfortable. We kind of like to bust through myths that do help us stay confused in this interesting time. And we also like to have a lot of laughs at the same time as we're doing the work. And it really serves because I try to be there for you every day, and it helps to create routine and focus. And I'm there with you, doing the work, doing the things every day, and walking along beside you. So the price is $35 a month. It comes with a discount to the Codes and Magic Apothecary, so the botanical medicine business I mentioned before. I do have a discounted price for my private practice clients. So anybody who's doing personal training or nutrition coaching, all those things, you get a discount. And if that $35 is a problem, because I get it might be for some and it's something you're really interested in doing, just reach out. We can chat and see what we can come up with. So reach out, any questions you have, any comments, and yeah, like I said, I am really looking forward to life going forward this year, all the things that we can do. And it was just kind of nice to take some time away at the end of the year and kind of come back with a new sense of drive and vigor, I guess. So we will be getting things back up. So I should probably tell you there's a name to this program. It's called Power. Like I said, it's going to be focusing all on functional breathing. And obviously that's going to spill over into just an overall general health. And we've got private channels that we use, and I'll be rolling out some of those for we kind of have like a new start. We're going to aim for January 15th to get rolling again. Like I said, we've been taking a bit of a break, which I think we all needed at the end of the year, and just some time to roll into the beginning of this year as well. So I hope you are all well. Like I said, reach out with your questions, your comments, and I really look forward to interacting with you a lot more in this space this year. So until then, We will chat soon. Bye bye.